I am Pam Lees from Public Health Ontario, and welcome to our learning and sharing session to go over the Indigenous Lead Talking Circle report as an overview and share stories and reflections from that process and to apply it to our work. I'll give some brief acknowledgements and then I'll turn it over to my co-moderator, Ashley Smoke, for her welcome. And then we'll have our opening and begin with our speakers. As we start today, I want to acknowledge the land that we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, Haudenosaunee, and Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. And acknowledging that where we're hosting from today in Toronto is also covered by Treaty 13 with the Mississaugas of the Credit. I'm coming to this session in the position of an uninvited settler of European descent on these lands, and with respect for Indigenous people and the traditional territory. And also we're supporting in our project the importance of cultural competence and safety and meaningful relationships in the work that we do in public health and overdose prevention. Leading up to tomorrow as the National Day for Truth and Reconciliation, I also wanted to draw our attention to the call to action number 22 for the PRC Commission of Canada, so calling on those who can affect change in the Canadian healthcare system to recognize the value of Aboriginal healing practices and to use them in treatment of people in collaboration with healers and elders and at the request of Aboriginal patients. So something that does connect to our topic today. The next acknowledgement is certainly about the strengths, innovation, and leadership of people who use drugs in responding to the overdose crisis, and our commitment to partnership and ongoing learning in the work that we do. With those acknowledgements, I'll ask Ashley Smoke to, I'll turn it over to you for the welcome for our session.
Hi, my name is Ashley Smoke. I come to this work as someone who is a person who uses drugs, and I co-founded a group of folks who use drugs, and we are forming a network called the Ontario Network of People Who Use Drugs, which is a newly founded non-for-profit organization led by diverse people with lived and living experience of drug use who inform and shape drug policy, laws, and services through activism, advising, and consultation, as well as capacity building. Our vision is an Ontario where all people who use drugs can thrive. And we recognize that communities across Ontario grieve lives lost due to the overdose crisis, which during COVID-19 has been mostly ignored because of stigma and criminalization, which Indigenous folks experience at rates much higher than the rest of folks. But people will continue to lose their loved ones if the health disparities and harmful drug policies remain unaddressed and unchanged. We will continue to see the number of fatalities rise. People who use drugs have been on the front lines of this war and have been resilient even when there shouldn't be a need for it. And we can't continue to see our friends die and allow society to think it's okay. Recently, in our meetings, we came to this part, the land acknowledgement part of the meeting, and I just, it doesn't sit right with me, like reading a land acknowledgement and just like saying the same thing over and over again. So one thing we decided to do was we were gonna come together, and because of the date, it's National Truth and Reconciliation Day coming up tomorrow. One thing I was thinking we could do is in our meeting tonight, I was thinking we would share and come together and really make like a land acknowledgement that was like action oriented and something that we could not just like reading and honoring the land we're on, but also acknowledging how we can come together with all communities and really make an action plan as to how we can educate people on the harms that Indigenous folks face, especially ones who use drugs.
Thanks, Ashley. We do have our opening now, inviting Elder Blue Waters to support our meeting with an opening before our speakers. So Elder Blue, over to you, please.
Thank you, Pam, and thank you to each one of you who have chosen to show up here today to come share your knowledge, your wisdom, your words, your heart, and your thoughts. So, Tanseyaski Nikamun, Natisina Kasun, Mayendindo Dem, Tatakup, Saskatchewan, Eskazoni, Red River, Nadunjaba, Ayakwe. So, as we come together, normally we do this opening first and foremost once we say what is going to be happening today. And it's very important that we start off this way in a good way so that ideas, when they come together, sometimes can clash. And so we ask today that the Creator and all of those ancestors that are gone on before us come and help us do this work today in the best way possible. Help us to share our views and our knowledge and our information in a kind and gentle, respectful way to each other. Because we know there's so much broken in our systems, sometimes we become very frustrated, and which makes us very emotional or triggered or angry. So we look for help from the Creator and those people gone on before us to help us do this work the best way possible. And we also ask those little ones waiting to be born to come and sit with us today as well. Come and hear what our intentions, our plans, our visions are for making this earth, our mother, the earth, a safe space for you to come into a human being. And so that we can help you navigate your journey as we're navigating our journey along this path that we are maneuvering through this most difficult time. So I ask for that help from the Creator and those gone on before and those ones yet to come so that we can do this work. And, I would remind you if something is pressing on your spirit or on your emotions, to take that few minutes to just mute yourself, take your camera off, focus on your breathing, try to recenter yourself. If you have traditional medicines and you use them, that would be a good time to utilize that. Also to reach out in the chat to the organizers to have a resource of someone that you can speak to. It's very important that we do this work and not become overburdened or over frustrated with it, because when we do that, the work does not get completed. But yet we do need to take care of our mind, our body, our spirit as we're doing this work. So I ask for help from this, from all of creation, that we move forward in this good way and to do the best work that we can do, not only for ourselves, our family, our communities, but for every person that breathes the air that we've been gifted from all of creation each and every day. So for that, I say, hi, Miigwech, and I'll turn it back over now for the meeting to move forward in the best way possible. So, hi, Miigwech.
Thank you, Alder Blue Waters, for your words and your opening and helping us move forward with this important discussion today. So with the objectives today, we wanted to describe the key stories and recommendations. We'll hear about the report, the Indigenous Lead Talking Circle report, and understand the experiences of Indigenous communities in mitigating overdose and opioid-related harms, and be building linkages between the content of today's discussion and our actions and practices. Just the next slide, please, Caroline. So for the agenda, the next items are our two speakers from Two-Spirited people of the First Nations who led the report, Sage McMahon and Sarah Anderson. I'll turn it over to Sage momentarily, but we just have two brief polling questions, just so everyone can let people know where they're coming from and introduce each other to let you know who's in the room. If you wanted to put anything in the chat to introduce yourself, and with the polling questions, what part of Ontario you're coming from, and the next one about your position. Okay, so looks like there are people joining from all over the province, many from Toronto. Thanks for letting us know what area you're coming from. And then just for the next question here, where you're working, what type of organization, if you can just let people in the room know. And thanks, I guess, with Nalin, you're joining from BC. Thanks for putting that into the chat. Seeing a lot of people are coming from public health, but certainly from other organizations, coming from family practice, I see in the chat, drug strategies and community agencies, some from hospitals as well. So thanks so much for letting us know where you're joining from child welfare, hospital, family practice, so a few others as well. Great, so maybe Lydia, if you don't mind just sharing so others can see where everyone's coming from, and then I'll turn it over to Sage, and we're looking forward to hearing more about the report. Okay, so just with the next slide, please, Caroline.
Pam, before we move forward, if you could explain to people how this information will be captured and stored and used, just for people's understanding, because they may be sharing things that could be sensitive, and it's always a concern in Indigenous communities where our information is going and who sees it and what happens with it. So just to create that sense of safety and well-being and knowledge for all.
Thanks for that question as well. So with this is mostly to share with each other on this call to provide a support for the discussion, and everything will remain anonymous. You're able to enter your feedback anonymously to share for the purpose of discussion in this meeting, and we may have some of the information available afterwards to summarize summarize the thoughts from this discussion as well, but all of it will be for the purpose of supporting the work that people in local communities across Ontario are doing to respond to overdose, in supporting good relationships with Indigenous partners, and none of it will be identifiable. So also happy to take questions, and it's also up to any of you whether you participate in the Mentee or not. So I hope that that addresses your comment, and thank you for that. And just a brief disclaimer here that the next content that we're presenting is from our external partners at the Two-Spirited people of the First Nations, and we're grateful to be working with them today and hearing about this work. So I'll turn it over to you, Sage.
Annie, bonjour everyone. So here's kind of an introduction to what we'll be talking about today. Could you go to the next slide? So here's kind of an outline of what I'll be covering from the report that we put together. We'll be talking about relationship building with Indigenous communities, meaningful relationships, and specifically within overdose and opiate response, best practices and accountability. Next slide, please. So first off, start with a little bit of an introduction to who I am. So my name is Sage McMahon. I'm a Anishinaabe from Treaty 3 territories, Rainy River First Nations. I am Bear Clan, and I reside in and work in Toronto at Two-Spirited People of the First Nations. I am the manager of harm reduction and all programming there. The Let's Reclaim Our Place in the Circle Together is kind of a motto that we share at Two Spirits, and one that we kind of gathered with community to discuss. Next slide. So I'll just give kind of a background or an overview of the report and where it started. So we had two talking circles, one for service users and one for service providers. In total, between the two talking circles, we had 39 participants, one elder. Elder Blue is the elder who joined us and is here with us today. And then we had 3 Indigenous field experts who really just acted as an aid to facilitating the conversations that we were having. Majority of the folks who joined in were from the GTA, but some were spread across Ontario. So some in Rainy River, Cambridge, Fort Frances, and Waterloo. Next slide, please. So one of the questions brought forward for the talking circles was around relationship building with Indigenous communities and how one can go about kind of creating those initial conversations, or those begin to make those roots. And so through the conversations that we had with our participants, there were kind of 3 main topics that came about. One was an understanding of historical context. So through truth and reconciliation, it's really important for folks working alongside those who do use drugs and who are Indigenous to understand that truth has to happen before that reconciliation can happen. And so that truth is a lot of hard work. It's really getting to the basis of who you are as a person, any biases you carry, maybe in the work that you're doing, in the interactions that you hold with folks. And then another point was to understand the institutional violence that Indigenous folks and communities face through various systems. So through the health system, education system, judicial system, with police, and then also with us, as a lot of us, it said a lot of folks on this call work in public health, or at other community orgs, hospitals, child welfare agencies. Many of what we do, while it may be trying to work alongside communities or help communities, it can also act as a barrier to those communities, especially for folks who use substances. For folks who have to, for instance, come to our space to get harm reduction supplies, they have to come in, introduce themselves and kind of ask what they need. So that in itself can be a barrier for folks who've for years experienced the discrimination and those biases that come along with those folks who use substances. Another way that folks thought was important in relationship building is focusing in kind of our traditional, our traditional ways of doing. And so one of the most important things was humanizing the crisis, understanding that while this is a public health crisis, there are people at the end of what we're doing and at the beginning of what we're doing. And so centering those people in what we're doing and centering those people in the conversations that we're having is key and fundamental to the work. And then understanding things through the lens of the 7 grandfather teachings, and then putting those things in practice. So within our work, holding on to love, showing respect, using honesty and using bravery, giving truth to people, using our wisdom, and then acknowledging our humility. Those are all important aspects to the work we do along folks who are using substances. As a community, we are very relational. It's why Ashley, it's why Blue, it's why I all introduced ourselves how we did, where we came from, how we connect to the land, how we acknowledge our ancestors. It's because we as a community are relational with one another. It's how we gather, it's how we feast, we share, we connect. And so shifting our work to be more relational with one another, knowing that sometimes, while it may not always be seen as the most appropriate, sometimes it's okay to give our community members hugs when they're hurting and when they need it. It's okay to be that acting of support, right? And then it's really important that that stigma and that access to dignified and compassionate care is there in all of the work that we're doing, because without those things, that's where we're seeing a lot of our community members die in this crisis. The third thing is community engagement. And so Indigenous voices must be centered in these conversations. People who use substances must be centered in these conversations. And then amongst those, the intersecting identities that all of those folks carry. So two-spirited folks, people with HIV, people with disabilities, Afro-Indigenous folks, people with mental health challenges. All of these things need to be taken into consideration and engaged with when we're having these conversations about how to build better relationships with Indigenous communities. And then it's also important to note that trust and relationship building really takes time. It isn't a quick fix. It isn't something that will happen overnight. It takes time, it takes energy, and it takes a lot of resources. Next slide, please. And so building meaningful relationships with Indigenous communities, what can this look like? How can it be achieved? So in particular, we spoke about this in relation to kind of knowledge sharing groups or organizations. And so participants really discussed kind of a lack of access to key stakeholder tables, being more than just kind of a one-off. Often we'll get invited to things to talk, to share our knowledge, to share our experiences, but it's more of just a one-off. It's a one-time thing, and it doesn't necessarily ever lead to something long-term or to something that is tangible for our community, that we can say we have ownership over this, or we were a part of this, and this is how we can watch it grow. And then engagement with Indigenous folks at all levels of the work that we're doing is really important. So from frontline to management, and it's important to have Indigenous folks involved in all of those aspects. The knowledge that we would bring to the table is important through all of that, not just our frontline, not just as peers, not just as people with lived experience, but as people who can really bring something to the table at all levels. Elders should be consulted with and available for community members. So in the work that you are doing, elders should always be consulted, but they should also be available for our community members when you're doing that frontline work. If you want to kind of build that capacity and those meaningful relationships, having access to that traditional culture and knowledge is really key. And then access to funding was a key component that we discussed. And access to funding in a way that isn't always kind of mining our community for its trauma. So not having to always apply for funding to say, oh, our community isn't doing well. These are the ways we aren't doing well, and here's how we want to better support them. But just to apply for funding to say, here's kind of the beautiful things our community is doing. Here's the art that we want to do. Here's the way we want to feast as community, and be able to get funding for those things. We want to be able to celebrate as community just as much as we are kind of supporting one another. And then acknowledging expertise is different than within a Western context. So understanding that while degrees and all of those things are quite important, and quite important into the work that we do at times. Lived experience, knowledge, roots to community, experience working with various people within community. Those things are also just so important to us and in the way we kind of engage with one another on a community level. So really reframing the way in which you look at what expert is and how that expertise can be shaped. And then how meaningful relationships with Indigenous communities in overdose response specifically. We really talked a lot here about having connection to culture, having connection to those traditions, to the land, ceremonies specifically for folks who use substances. A lot of, even within the Indigenous community, a lot of folks talk about kind of this 3-day rule where you have to be sober for 3 days in order to attend ceremony. And for a lot of our community who use substances, that's just not a reality, right? And so we're really pushing away the people who may need ceremony the most away from those spaces. And we're really trying to kind of reframe that and get away from that and really ensure that everyone has a seat at that table and has a seat at reconnecting to their culture and those ceremonies. Again, kind of working and putting into practice those 7 grandfather teachings. So our love, respect, honesty, bravery, truth, wisdom, humility. Something Elder Blue shared in the talking circles was that our medicines and our ceremonies are here to protect us and keep us safe. And so, like I said, we really need to make sure that our community members, while we're doing overdose or opiate response, they have access to those things, their safety, their mental health, their physical health, their spiritual health. All of these things kind of depend on having access to those things. And it's really important that through this work, it isn't tokenized. It isn't just kind of a feather or a medicine wheel slapped onto the way in which you're going to do a work plan or the way in which you do outreach, but that it's really intentional. And there's a lot of work that gets put into it. And it's important that folks listen, really listening to Indigenous folks who are and have been talking about these things for a really long time, because we are the experts in our own experiences and we know best how to support our people. And like I mentioned before, the work really needs to be relational. It needs to be a circle where there's room for everyone at the table. There needs to be an opportunity when you're supporting an individual in overdose and opiate response, that their family has a room at the table, that their friends, that their community has room at the table, that there's aunties and uncles around to support them. We're very relational and we work having everyone within that circle, and that's an opportunity of kind of extending our care. And it can't just be we at public health kind of know best, or we at the hospitals, or we at whatever institution know best. So this is how you should do it. It has to be relational. It has to be something that we are taking both expertise and centering both of those things and really learning from one another of how we can do this work. Next slide, please. So there were some best practices that we kind of discussed as a group. And the first was having a multifaceted approach to care. And so understanding that not a one-size-all model fits for everyone, specifically for Indigenous folks who have had that historical colonial trauma. Not everything is going to work. Not everything is going to work for the same person as it would for another person. So it's really having that multi-pronged approach to deal with and have the flexibility to provide what's needed for folks. And it's an understanding that in most cases, the drugs are really not the problem. They're just the vehicle of what's happening. And so it's important to contextualize the issue. In centering Indigenous approaches to harm reduction, at Two Spirits, we say that everything that we do is harm reduction because everything that we do reduces the harm of colonization. So whether it's programming, beating, drumming, medicine walks, any of those things, and then kind of mental health support with meetings with Blue, all of those things reduce the harm of colonization. So all of those things are harm reduction. It's important to, like I said before, humanize the crisis. Safe supply, decriminalization, injection sites, drug testing, all of those things alone will not fix the crisis. The work needs to be done to get to the roots of these issues, and namely kind of tackle the results of colonization. And the community discussed kind of the need for more wraparound services that are community-based, and so which kind of goes hand in hand in kind of timelines of intervention. We need to ensure that when folks are asking for support and coming to us for those support, that we have those systems in place. We shouldn't be doing the work if we don't have those systems in place yet, if we can't do the wraparound work to really support folks how they need to be supported. And then lastly, it was kind of access to our ways of doing. So access to medicines, culture, traditions, elders, the land. For instance, on our outreach, which we go, Sarah and I and others from the team go on outreach weekly, 2 times a week. We always bring medicines. And it was one point last summer, we were smudging in the outreach van. And somebody approached us already in tears, just saying, thank you so much for bringing medicines to me, because it's been years since I've had access to them, that I've smelled them. It brought me back home. I didn't think I was worthy enough to have those medicines around me. I didn't think I was safe enough to have those medicines around me. So just thank you so much for doing that for me. I really needed that. So really giving folks kind of that opportunity to reconnect with their culture and have those moments where they're able to smudge or connect with an elder. Those are really key to supporting Indigenous folks in this work. Next slide, please. So accountability. What does accountability look like within our communities? How can that be modeled in opioid and overdose response work? So like I said previously, these conversations have been happening for years, long before I was in this role. And our models of kind of accountability within our communities, again, have been happening for just generations. And often it goes back to council development and how those with lived or living experience, elders, community stakeholders, Indigenous agencies, community leaders can all sit on a council and guide the work that you're doing, even as non-Indigenous agencies, so that you have a group of folks who are able to really lead the work or be centered in the work that we're doing. And we all have a role in this work. Everyone has a role, and everyone's role is different. I know right now my role is doing that frontline work. That isn't everybody's role. Not everyone should be expected to do that frontline work. But for instance, if you're in policy, do the work around policy to get more Indigenous folks in that space, to have more understanding of what our community needs. And so find your role and really hone in on that and do that well. And then next slide, please. And so lastly, our final kind of takeaways from the report is that our support has to be individualized. Everyone is part of the circle. Everyone's voice is just as equal in the circle. And our harm reduction efforts need to reduce the effects of colonization in our communities. That must kind of be the goal in all the work that we're doing. So that is just to summarize the report. Thank you all for listening. I think Sarah will now be sharing some of her experiences.
Ani, everyone. My name is Sarah Anderson. Sorry, it gets a little nerve-wracking for me sometimes, but yeah, my pronouns are she, her, they. I am two-spirited. I am Mohawk. My ancestors are from St. Regis, Quebec, Akwesasne. My spirit name is She Walks on Rainbows. And I'm from Turtle and Wolf Clan. So for myself, talking circles like ones that we conducted for substance users are extremely crucial and important for people to not feel alone, and so that they can see that the impossible is possible. This is one of the reasons for me participating in these talking circles, so that people can hear about my lived experiences. which may help others. From me sharing my stories, and so for people so they don't feel alone. Many people will resonate with my story. Some might not, some might only resonate with a little bit, and that's okay. I share my stories so that people can see that it is possible to break the chains of dysfunction and trauma and substance use if they choose to. And if they don't, again, that's okay. Speaking for myself, I grew up in a very traumatic household, dysfunctional, and lived in poverty. From the ages of 12 to 25, I was on and off of the streets. I committed crime, amongst other things. I also found out at a very young age that I could escape by numbing my pain, by using substances, to be able to escape reality. Breakaway Community Services was another nonprofit harm reduction agency that helped me when I was going through my journey. They never looked at me any different. They never treated me any different. They were supportive with all of my goals and all of my decisions in my life. After many years of working on myself, doing various programs, completing programs such as counseling, treatment, traditional healing, cultural support, Indigenous and non-Indigenous aspects and views. The Aboriginal Day withdrawal program helped me work towards healing. Since 2008, I've been turning my life around and working on myself. But the more that I digged into my roots, approximately 7 years ago, and the more I followed my traditional ways, my Indigenous ancestry helped me to want to dig deeper into my culture. Initially, I started at Two Spirits as a community member. I went back to school, and when I went back to school, I needed to do my placement somewhere, and I couldn't think of somewhere better to be able to do my placement. Everything that Two Spirits valued and were working towards was what I had visioned. After completing my student placement hours, I was hired as a supply staff, typically doing outreach. All of the teachings and lessons that I have learned in my life and experience, I'm now utilizing in the work I do with harm reduction here at Two Spirits. The reason behind me wanting to work and help in the harm reduction team was a way of me giving back to the community. And to be a support for somebody like I needed when I needed the support. Throughout the lessons I learned, it is extremely important to meet people where they're at, to not judge them. Like Sage was saying, to talk and follow the 7 grandfather teachings. I've incorporated the 7 grandfather teachings, not just in my personal life, but in my professional life also. One of the amazing things that I do here at Two Spirits is being able to give community members medicines. Like again, Sage was mentioning, and some places people don't use medicines because of messages that we're told. And my beliefs and my thoughts are, our medicines are very strong. They're very powerful. They can handle anything, really. And to me, that's when our people, or Indigenous people, need our medicines the most, is when they're going through whatever that might be. Just because they might be using substances or alcohol doesn't mean that they don't have a right to ceremony. It doesn't mean they don't have a right to smudge or be given bundles and it means they need it. And so that's one of the things that I absolutely love that we do. And like, again, like Sage was mentioning, I remember the individual and coming up and talking to us. And it's not just that one person. We've had a few people that originally were scared. They didn't want to touch the medicines. They couldn't, and they weren't allowed. And now they come up and they ask for those medicines, and or they ask if they can smudge with us. So I think it's extremely important. It also helps build relationships. You know, building relationships and building trust takes time. Again, like Sage was saying, this is our way of being able to open and hold that space for them. We also give out tobacco ties, medicine bundles, traditional medicines, while we're out for harm reduction. This also helps build a sense of comfort for community and between the two spirit staff or team members. For service users, traditional and cultural methods are used as such as providing access to traditional medicines, offering services as traditional healers, and providing them access to various culture events, program, as well as ceremonies. I try to use our culture, and it brings us into I try to use my culture and bring it into our harm reduction programs and help support people in the best way possible by using traditional teachings, culture values. Having lived through these experiences myself, it helps me put myself in their shoes and feel what they are feeling and help in a way I wanted people to help and support me while I was going through my own journey. And I think that's it.
Thank you so much, Sarah, and to Sage as well, and everybody who participated in the report. We have a lot to listen and reflect on, and the responsibility to act in our work, and really grateful for your stories and sharing your strengths and how you're working. So just on to the next slide here, Caroline, please. So we're going to have our facilitated discussion. Ashley will be the lead for this, and feel free, Ashley, to call on me for any of the questions to support reading them out as well. And we have some that were submitted. Thank you to those who did submit questions with the registration that we'll go over, and we invite people to also submit their questions and comments in the chat box for more discussion as well. So Ashley, over to you, please.
Thank you. As settlers, well, I'm not a settler, but how can settlers navigate the tension between harm reduction and abstinence-based approaches while supporting Indigenous persons and self-determination?
Yeah, I think kind of goes to what I was saying about having a really individualized approach for everyone. And so like Sarah was saying, there are some folks who, when they approach us, they won't touch the medicines, or they don't want access to any of the ceremony or the elders because they've been told for years that they don't deserve to be there. They're not a safe person to be there. And we have so many of our elders who are so abstinence-based within the community, and who preach those things and who say things about not having folks who use substances in ceremony, or the 3-day sober rule. And all of those are results of colonization. And so it's really kind of having those discussions and breaking those walls down, but also meeting folks where they're at, right? If somebody says they don't want medicines, we don't go, well, it's harm reduction, you need them. right? They're not there yet. Everyone is on their own path and everyone is on their own journey with those teachings. Everyone has their own teachings. And so it's really using those 7 grandfather teachings, like we said, and respecting those things that people bring to the table, respecting where people are at and meeting them there and saying, okay, well, how can I better support you then? It may be different from the next Indigenous person that we work alongside, but how can I better support you? And so some folks will have that abstinence-based approach. Some elders will, some community members will, and then others won't really. And so, yeah, it's something that we're all navigating kind of all of the time. And I think the best way to do it is on an individual approach, right? And having a multifaceted approach, understanding that some people need care in a different way while others don't. And I think, in my opinion, that's the best approach. I don't know if anyone else wanted to add anything there as well.
Thank you. I think it's important to reinforce the fact that harm reduction meets people where they're at, like you said, and it's a full spectrum of supports, really. Like, it starts meeting someone where they're at in their drug use, but who's to say that that doesn't mean abstinence down the line? So I think having these conversations and doing circles for elders and people who use drugs, like, I think getting everyone together, like you said, and having these conversations is very important. And definitely, like, autonomy is so key when dealing with people and caring for the community, right? Equity. What are ways we can pay attention to those most marginalized and vulnerable, like women or remote Indigenous communities?
Yeah, I think those conversations are happening. So it's kind of on you to tune into them, right? And so those conversations have been happening within our communities for generations now on how we best support each other, how we take care of one another, how we include everyone in a space. And so it's really about folks kind of tuning into those conversations and making sure you're really centering those people in those conversations. So not saying, say somebody says, well, I need, they come up to our van and they say, I need 100 STEM kits. It's not my job to say, no, you don't. You probably only need 10. It's my job to say, great, let's get you those 100. If I don't have 100, we'll go back to the office and grab more, right? So it's listening to those folks and then actually following through with what those needs are. And so the way you can pay attention to the most marginalized and vulnerable, I think vulnerable is a bit, I don't love that word. I think vulnerable makes it seem as though it's their fault, and that's not the case, right? They're marginalized intentionally through the systems that we all kind of work and live within. And so I think you have to it takes work, it takes time, it takes resources, it takes money at times, right? It's centering people in those conversations who are the experts in those spaces. So if you want to hear more about Indigenous women, center those voices in that conversation, center two-spirited women in those conversations, center trans Indigenous women in those conversations. If you want to hear more about remote Indigenous communities, listen to them, because they're all talking. None of these communities are sitting in silence, right? So it's really everyone else's job to really just listen in and hone in on those voices that are already doing that work.
That's great. I think I think you're so right. And it's important to take that step and, like, go to where they're having those conversations and, like, take that upon yourself and don't think that it's owed to you for us to come teach you. Do you have anything to add, Sarah?
No, not really. I do, like, I agree with Sage in the sense of it's really easy to listen and hear what marginalized communities need. And like Sage said, we don't there's many different forms of harm reduction, and when someone asks for something, we don't challenge that, and if they don't want it, we also don't challenge that. And if they want extra food, even we don't challenge that, right? And so we, you know, we try to give what we can, obviously, but we try also to not limit things such as food and harm reduction, because we, you know, we can always get harm reduction. So yeah, that's all.
Thanks. So COVID-19, what has access to harm reduction services been like for people on opioid agonist treatment and those new to OAT during COVID? Have circumstances improved as Ontario reopens?
Yeah, I don't know that I can necessarily talk about Ontario as a whole, right? So I'm based in Toronto, and I only know what I know. And my experiences are of what's happened in Toronto. So I think at the beginning of COVID, like everything shut down. And that included community services, that included harm reduction services, injection sites, any treatment services, all of those, everything shut down, right? So our community was just really put in a tough spot where they were just kind of forced to figure things out on their own at a time when everything was so heightened and stressful and complicated. And so I think since then, obviously things have gotten to a better place, and services and everything has started to kind of grow back up. But I think that I imagine that that's probably not the case for all of Ontario, right? And so, like I said, I can only speak for Toronto, and I think that we have gotten back to a place where we're at least able to be providing all of the services we were before. Maybe not at the level that we were providing before COVID, but at least we're providing all of the services. But yeah, I don't know if that's a reality for across Ontario. I'm not sure.
Well, I guess I can speak to some of that. But like where my res is, everything's still shut down. There's no ceremonies, there's no powwows, there's no like cultural support. And that's part of, like, that is, in my opinion, that's part of opioid, or should be part of opioid agonist treatment, is like the other part, the social aspects and the cultural aspects. So yeah, it's, I mean, we saw, like, and speaking from the perspective of someone who uses drugs, we saw like a really cohesive approach to an epidemic and what that looks like with COVID. And you almost feel the discrimination when you look at the number of overdoses rising, while the number of COVID cases is lowering. We feel like, I feel like our lives don't matter as much. And OAT isn't really as effective anymore because of the toxic street supply that is getting increasingly more erratic as time goes on and through this whole COVID pandemic. But yeah, it's kind of like the inaction on the government feels discriminatory to me. I don't know. That's how I perceive it.
Yeah, and I think in Toronto we're seeing more overdoses now than like ever in reported history, and so obviously what the approach has been in the past isn't working. We can tell it's not working. So the Western, maybe more medical based way of doing things, obviously fundamental to the care that we support, but it has to be paired with our more traditional cultural based things in order to support the community better, right? We can see that one way isn't working, so let's try kind of, like I said, like a multifaceted approach. Let's have all of those four aspects of the medicine wheel be paid attention to at once, instead of just focusing on one, the physical, or one, the mental, right? So it's really taking all of those things into account and adjusting our care so that it can include more aspects that are needed to create a better approach to care for folks.
Did you have any experiences during COVID that you wanted to share, Sarah, in regards to treatment?
So yes, I can also only speak in regards to Toronto. Luckily enough, for the whole pandemic, we did work. And what I can say is, in ways it helped us build relationships, because there wasn't many people that were continuing to, like Sage was saying, everything was shut down, a lot of, organizations. So in ways it helped me and another team member of ours be able to build those relationships, and from community members themselves would be not only so appreciative, but seeing how much we cared. And I'm not trying to say anything about any other agency. It was obviously because of COVID, but it really, again, it just helped us be able to build better relationships and stronger relationships. It earned more trust within the community, to know that we were still there on the front lines. We were still showing up. They wait for us. They know our vehicle. They know what days we're working. And so many people would come up, oh, you guys are still here. And oh, and it's like, so yeah, so fortunately enough, we did still work. But in the sense of, the opioid crisis, and like you said, the substances are not, I don't know how to put it into certain words, but obviously the substances are a lot stronger, and the stuff that, how they're making it, with the overdoses and all of the deaths, either within our community or on the outscenes of our community. Something obviously needs to change, and the approach we were doing is not working the way we would like for it to work.
You. Okay, so now I think we're going to open it up to questions from the attendees. So if you could use the hand raise function or the chat box, we'd appreciate it. And Pam, can you read the questions from the chat box, please?
Yes, I hope I'm not missing any. I did see a hand raised from Michelle Kazmarek. If you want to unmute.
In the meantime, how do you honor yourselves doing this work? Like, how do you guys take care of, how do you guys take care of yourself culturally while you guys are doing all this important work?
I think we're really lucky with the team that we have. We kind of, I don't love when workspaces are like, we're a family, but we really are there to support one another with whatever is needed, whether it's personal or have to do with our work, right? And so we have check-ins every day with one another. The entire team checks in, and it isn't even necessarily like a how's your business day going, but just how are you doing? We have Elder Blue, who we're able to connect with, and then all of the programs and all of the services we offer are also offered to our team and our staff. And so if you ever need like mental health supports, if you need medicines, if you need a food hamper, if you want to join programming, all of those things, you're available. Like we want you to join. We want you to continue learning and engaging in those things. Again, like Sarah said, that's how we build capacity, and it's how we build community and relationships with communities, by being there on those things with them. And then it also, what we do at our workspace is we have 4-day weeks. So I think that has been really great for the team, because it gives them part of their life back as well, to say, take the time you need to do whatever care you need for yourself. We have conversations around kind of that self-care and what that can look like a lot. And then we have like times where we're just able to be a team together and just like enjoy life. I think it was 2 weekends ago, we had a staff party, and we just were able to like enjoy each other kind of outside of that work environment, and outside of like that emotional labor environment and that stressful environment, right? And then there's times when, yeah, there's just hard days. There's times when we have to respond to 3 overdoses in the park on one 3-hour shift that we're in there doing outreach, and that's emotionally draining. Or there's times when some of our community members go missing and we haven't seen them for weeks, right? And so all of that work is really emotional draining, and it's just really taking that time and that space to smudge or to sit with one another, even in silence, and just kind of take the space you need. I think we're all really understanding of the work that we do and what we would need individually to take care of ourselves. So that's really great as well.
I think that's important to note, because like, even if you have Indigenous folks on your team, these are things that you can do to support them, or you can ensure that they have access to support them in taking care of themselves. So we have one question here from Netta. Can you say more about the role of medicines in harm reduction?
Yeah, sure. I can talk about it in terms of kind of our harm reduction. So like I said, for us, everything that we do is harm reduction. And so medicines are an important part to kind of all of our programming and our support. We deliver medicine bundles to our community. We weekly on Wednesdays, actually. So I think it's happening right now. Our team is out delivering food hampers to folks, medicine hampers, and hygiene hampers to our community members. So anyone calls and registers, and we sign them up and we deliver it to them, right? And so it's getting people access to those medicines. They don't have to say what they need to use them for. It's just, you need medicines, great, let's get them to you. And then in terms of like specifically kind of our outreach, I think in the past we have had tobacco ties or little medicine. We would have like little small medicine packages with all 4 medicines in it, and we would put them in all of our harm reduction kits. We started to notice that some folks who maybe weren't Indigenous or maybe didn't understand how sacred these medicines were would just kind of toss them out or just leave them on the ground, or we would find them in the park kind of all over the place, or being stepped on or whatever. And so we stopped doing that, but now just have them on our van. So we provide them to anyone who wants them. We smudge while we're out doing outreach. And if anyone approaches asking to smudge, we kind of let them do that. We always have medicines on us. We always have tobacco ties on us. And then we also kind of, because when one person comes up, then another person sees what they just got, right? And so often folks will say like, well, what is that? And they may not be Indigenous, but they'll say, well, what is that? I want tobacco as well. And what our job is to say, okay, but we're going to teach you about it first. We're going to tell you what it means to us, so that you aren't just taking it and doing something like putting it on the ground or stepping on it or something like that. You're going to know what it means to us. You're going to know how sacred it is to us, and you're going to care for it just like we would. And so it's part of it is education around those things, and part of it is just kind of no questions asked, supplying it to our community whenever they need.
Thanks. Okay, so now I think it's time to go to the activity portion. Okay, so you go to menti.com and you put in this code 17449320. And the first question is, based on what we've heard, what are priorities for taking action in your organization?
That's great. So I'll read some of these out as others are entering, and invite you to keep entering your thoughts here. Cultural safety, better outreach, centering colonialism, representation, advocacy, strengthening relationships, involving knowledge experts throughout the incorporating cultural needs into our practices, helping build capacity for agencies to provide strong evidence to Indigenous clients, education awareness among staff, relationship building and advocacy, and educating everyone in our organization and all of our work. Yeah. And does anyone on the panel or Alder Blue, would you like to say anything about what you're seeing here?
Yeah, Sage, I wanted to speak to, we're in 2021, and I don't think people really have yet a grasp of what harm reduction is. We're working within a Western way of being as Indigenous people. And Western ways of being when it comes to health are not the same as Indigenous wellness. You briefly touched on this, Sage, where, we look at our health as being spiritual, emotional, physical, and intellectual, where the Western way of well-being is based on only basically intellectual. So learning from one model that is applied against all. And that doesn't work. We know it doesn't work, not only for Indigenous people, but all marginalized POC people, people of color, Indigenous, Inuit, Métis. We need to look outside that box that's been given to us of what Western medicine looks like and what Western wellness looks like. And we really, this is what you're doing, is breaking down those barriers and saying, this is what it looks like. From an Indigenous perspective, harm reduction is exactly what it says, to reduce harm. But what are we reducing the harm from, right? That's what needs to be addressed, as well as, I seen a comment way earlier on about, the difference of abstinence and harm reduction. Well, it's two whole different concepts. If you're dealing with underlying issues which are causing you to have to turn towards substances to be able to manage and to live your daily life, well, if you've never experienced those harmfuls or those traumas, you cannot grasp the concept of harm reduction, right? You're looking at it as, well, you can just stop. Well, you can't just stop. Harm reduction encompasses so many areas in regards to one's mental health, and saying to someone, to be abstinent or to think about abstinence, they're not at that stage yet. And so there's many steps to get to the end of your journey. And we can't just be expected to fit into a Western understanding of going straight from not being well to here using these pharmaceutical medicines. And once you take them, you're better. Well, that doesn't work for everyone, because we haven't addressed the underlying issues in which someone is turning towards a substance or having to use a substance just to get through their day. And we need to really work in a holistic model, such as an Indigenous perspective of that medicine wheel of wellness, taking care of that person, making sure their spiritual needs, their understandings, their teachings, their culture, having them accepted into ceremonies, even though they're using a substance, and then deal with the emotional issues that come out of traumas and abuses and things that cause us to go working towards using a substance for coping and for moving forward with your day, so you can still be walking on our mother, the earth. And then physically, how are we helping them physically? Holding back medicines, holding back items such as needles, and safe spaces to use and to be monitored while they're using, to make sure that they didn't get a bad batch of something. And if they did, how can we help them at that moment? Not having people go run away and hide in dark corners because we're judgmental, following a Western way of dealing with health. And then to deal with them intellectually, right? To let them know that they are a beautiful gift from Creator, and that their thoughts, their experiences, everything that happens to them is important for all of society, because we bring our gifts when we come together and we share those gifts to help support and guide and lift up each other, instead of being critical and judgmental and wanting people to stop something because you don't know what it's like to be in that space. I'm very passionate about this subject, about you cannot know what someone's life is unless you walk alongside of them. And if you're not willing to walk alongside of them, then why are you in the business of helping people? Just my thoughts, and I don't mean to be critical, but sometimes the truth has to be spoken to bring to reality that it is broken out there and we need to fix it. And we can only do that by coming together and sharing our experiences, our knowledges, and what we need, and then finding the resources to make sure those needs are met. So thank you very much for allowing me to speak.
Thank you. I'm seeing some gratitude in the chat as well. Thank you. That is so perfectly worded, inspiring, and aha light bulb moment for me. Drawing some really important connections here in the work that we do. We have another polling question on the Mentimeter that we wanted to touch on. We can maybe just go over to next question. I see some have had a chance to answer here, and if you haven't yet, there's time to submit your answer here. To what degree have you or your organization invested in these three areas? So knowledge building and training, changes to practice or action, and relationship building with Indigenous people and organization. And there's a scale of 1 to 5 on the level of investment. So we'll just give you a minute to reflect on that and answer if you haven't had a chance. Great. So I think the responses have mostly come in at this point, and seeing that it's higher for the knowledge and training, but a bit lower still at this stage with the action and relationships is reflected here. I wonder if anyone has any comments they'd like to add or reflections from any of the speakers today.
I think, and not to be harsh here, it's also really important to be quite critical. So if this is on a scale of 1 to 5, right? And a lot of the folks in this room are putting it at pretty much a midway point, or actually over a midway point, because 2.5 would be midway. I think it's really important to be quite critical and say, are we really where we're marking ourselves to be, right? Because if we were, we'd probably have a lot better results within the communities that we're working within, right? So that's for the work we're doing as well. This is, I'm not saying this is a you problem. I think it's an all of us problem, right? So it's really being honest with yourself and brave enough to say, oh no, there's still a lot of work that needs to be done. And yes, we have done a lot of work, but there's still so much more to be done. And then in just looking at the results, I think it's important to, like Pam said, knowledge and training is obviously high, but then putting those things into action is lower, right? So it's really then making the work that you do be really intentional. So are you centering Indigenous people in your conversations, in the learning, in the knowledge building, in the training? And if you are, then why aren't you doing the actions to kind of back those up? Why aren't you following the lead of those Indigenous folks who are giving you that knowledge, right? And so I think it's really important that those initial steps, the knowledge and the training and the knowledge building, really follow action, because if not, then really Indigenous folks are just kind of constantly being mined for their knowledge and asked to share their knowledge, share their stories, but then nothing's being done with it. So that action that follows is really important as well.
Thank you so much. I really appreciate that, because it's true. It's human nature, right? To like give yourself a little bump in the score. So it's about like being honest about what the systems have done to the services we're trying to give. Okay, so the last question here is for Sage and Sarah. What do you want the audience to take away from this report?
Sarah, if you don't mind, I'll go first. We were given this question ahead of time. And so I took some time to reflect on it, and I kind of went through a range of answers of this is the thing, or this is the thing. And I was given a teaching a long time ago that said, really people will take from a conversation what they needed to take. And so everyone may probably walk away with something different, and that's okay. If you took anything, that's important, right? Because like I said, we all have a different role in this crisis. So people are going to take from different parts of what we all spoke to. But I think one thing for everyone is that this is really kind of the start. This is an initial, right? This isn't this conversation that we had today isn't a check mark to say, well, I've done it. You know, I've listened to the Indigenous people, or I've heard them out. I'm done. I did it. Good for me. Pat on the back, right? This is the start, or this is a step in your work to kind of working with Indigenous folks to better support them. And so I think that that's the one thing I would want, is just for folks to know that this really isn't whole enough to be it, but I'm really glad everyone joined, and that this is a step in a number of steps that need to be taken.
Yes, I have to agree with Sage. And like I shared earlier, even though I was a ball of nerves, I know with time this will get easier, talking and sharing with individuals. But yeah, like I said earlier, you know, some people may resonate with my story or other stories, and some might not. And it's again, take what you need. But the one thing that, you know, like Sage said, like this is a start, but the next step, you know, and to form, you know, this into more action is what I would like to see.
Thank you so much. Now I guess we're coming to a close. We're gonna do a wrap up, and Pam's gonna introduce the learning and sharing series.
Great, thanks so much. And just want to note in the chat the thank yous from everyone, and comments. Sarah, you're an amazing speaker and learning so much among everyone today. So that was, I think, a good last few comments with Sage and Sarah for leading into talking about the rest of the learning and sharing series. And also a lot of credit to Caroline on our team for the thought and the work that she's been putting into this with everyone partnered on this. And so the goals for the series, where we'll have a quarterly event to continue learning and discussing and acting in this area. We want to be able to work with other groups in strengthening the cultural competency and safety knowledge, skills, and practices in this work. Support building mutually meaningful relationships, and supporting partners and our team in the COMCAP project. So we haven't used that acronym really yet in this session, but the Community Overdose and Opioid Capacity Building project that this is part of, to identify and implement actions or changes to practice. So holding each other accountable as part of that, as Sage and Sarah have said. And I did see Elder Blue, your comment in the chat as well. The guiding principles are that the capacity building supports, webinars, and resources are led by partnering with Indigenous organizations, knowing best about this work, and being able to guide and guide us in that. Community initiatives and partner networks as part of the project are at various stages of knowledge and experiences, I think, as we saw on the Mentimeter activity, and that action, practice, change, and accountability are really those essential components in this, going from listening and deeper understanding to action. So the format, as I mentioned, is quarterly events, including presentations and training and resource sharing with each other, and and want to thank everybody for joining. So I'll turn it over to Ashley first in our moment of silence, and then to Elder Blue again to please lead us and guide us in our closing for today's event. And thanks, everyone.
So one thing we like to do at OnPut is to ground ourselves in the lives lost due to the opioid or the war on drugs, really. And we like to do a moment of silence to remember all of the people whose stories are behind all the supports we give and the data we collect and things like that. So if we could just have a moment of silence to remember those we've lost, I'd really appreciate it. Thank you. Now for a beautiful closing from our wonderful elder. Thanks, Blue.
Thank you so much. And, thank you to each of you who really showed that bravery of speaking out to things that need to be spoken about. It's not easy to share our truths and our realities. It does make us open in that way that we're met sometimes with a lot of resistance and a lot of contradictions and a lot of different understandings. So thank you for sharing your information today, for all those that shared. And, we called in those ancestors to come and sit with us when we started, and we looked towards the Creator and those ones that are yet to come to help us do this work. And I really believe, and I really advocate that we cannot forget our spirituality, knowing that there is that spirit that is greater and bigger than us and can really think outside those boxes much better than us, and really does and has had the experience and continues to help us experience how to live that Bamatsuin, that good life. And it's a journey to get there. And we look towards them, and we know when we call them, they come and they help us. And I believe they've done that work today for us. So I want to thank them for helping us do this work. And you heard me speak about Western ways of healthcare and Indigenous ways of healthcare and learning and well-being. We need to really see that we are constantly being pitted amongst each other, applying for funding and given that ability to self-sustain ourselves and our families. But we really do need to work outside that and work with each others and really reduce the numbers of siloing that we do with each other to work towards wellness for all. And so sometimes it involves us working extra, giving back to our communities, going that extra step, and really decolonizing our minds to methods that we've been using for hundreds of years since those boats landed on the shore and told us of the new way of being and learning and living. We need to decolonize some of that and take what is good from those Western ways, but really infuse Indigenous understandings in healthcare so that the needs of Indigenous people are thought about as being equal to and just as important as those Western ways of knowing that we've been told to work in those confinements. So let's unpack our minds, unpack those boxes with that one way of doing something, and continue working for the best of everyone's well-being, because that's what we're looking for, making people well. Well people don't go see doctors, sick people do. And you are all similar to a doctor. You are a helper of every human being that you come into contact with. It is your responsibility to do the best and to help the best that you can, and continue to seek the guidance from that spirituality that you hold, no matter how that looks like, in your own way of understanding spirituality and religion, and looking towards something bigger and more able to help us navigate this very difficult spaces that we walk within upon our Mother the Earth. So, Miigwech, hi, Walalin. I hope you go away with your minds filled with new information, your hearts open to be those helpers, and most of all, with your arms open to embrace change, because we know it's needed. So thank you. Have a beautiful afternoon.